keynote is entitled Streamlining AR, VR, and MR in Reproductive Medicine with Dr. Nahla Kazim from Bourne Hall Fertility Center. Welcome, Dr. Nahla.
Assalamu alaikum and good afternoon, everyone. After this extensive session, I am privileged to actually showcase, and it is my turn now to tell you as a physician who's been working in UAE, Abu Dhabi, since more than 25 years as a physician in obstetrics and gynecology, and moving on to the rare subspecialty of reproductive medicine. So, yes, we do carry the responsibility of carrying on the profession and practicing within the framework and the resources that we have over the years. So what was available to us at that time, what do we have today, and what we would like to even practice and hand it over to our future physicians. So there is the paradigm shift of healthcare sector that continues to be transformed with emerging technologies. All AR, VR, and metaverse, eventually they're laying pathways for artificial intelligence. What do we have now? Computational, real-time visualization platforms, smartphones in our hands, wearable gadgets, head-mounted gears, with microprocessing powers, instant access to web resources. We are working away from the desktop. I feel powerful, I feel more expert. Okay, I started my venture with AR and VR started in 2016. At that time, the global forecast was that the AR VR is expected to grow from around $800 million in 2017 to about $5 billion by 2023, of about 36% of annual growth rate. What were the major drivers at that time? Faster networks, we moved from 2G to 3G to 4G to 5G, and penetration of more web-connected applications, wearable devices, even at the healthcare sector. And there was an ongoing pursuit to see an alternatives that is cost effective. So, at personal level, my drivers are my children, my niece, my nephews. They're all holding tablets in their hands. They were already in 2016 playing simulation games such as Sims. I would go with my children and with my niece and nephews to game parks, and I would sit in the virtual roller coasters, and I would use the flight simulators also in Kidzania. Also, I belong to Kazim family. It's a known family in UAE for being the first physicians. So, besides being the first physicians or the leaders in the healthcare sectors, we also inherently carry our love for gadgets and knowing what's new in our world around us. Foremost important is the smart practice in line with UAE government's vision for integration of technical revolutions, putting UAE at #1 spot of world map. So, sorry for the graphics, but we're using simulators for a process called embryo transfer, and we do the training to do this intricate procedure. And also we are using the ARs to pinpoint and plan our surgeries, gynae surgeries. Also what we have so far is the time-lapse closed system monitorings that we monitor at the IVF laboratory, the growth and development of the embryos, using the embryo stereoscopes. So there is minimum intervention from human beings, minimum interruptions, and you can say also we are able to choose the best embryo that is suitable or has the potential to be implantable for the high success or pregnancy rate and healthy life birth. So I don't need to, you're all tech savvy, I don't need to tell you about what is AR and VR. In general, VR is a completely digital environment and AR is real world with digital information embedded. Sorry. So this is these are the things that I had used over the years. Where it says the VR case, the cost of that was, at that in 2016, $5. And the cost of HoloLens from Microsoft was $4,000. And I had worked with a group of enthusiastic tech-savvy people at the Future Hub who helped me to develop an application which is relevant to my practice. So, VR connect to a smartphone that is connected to the network. And what I have been using recently just to do the education of patients who are coming to be treated for IVF. The process of IVF is very lengthy and there is a lot of steps involved in this process. A lot of support is needed, a lot of education is required. But using this platform for those patients just made them to understand the disease from the basic, by understanding how we are developed and formed normally. The Microsoft HoloLens and IVF that I had used was basically for my egg retrieval procedures, where a surgical navigation system was developed, and I had planned the oocyte retrieval procedure by collecting all the images during the stimulation of the ovarian stimulation of a woman. I would take those images and superimpose it and use it at the time of the surgery, just for the accuracy of what I'm doing and what is the plan, and all the plan information of the patient is available on that platform. So it's hands-free, paperless checklist was there, allows verification of the couple. It's the only process in the healthcare sector where we need to deal with husband and wife together. So we are dealing with a lot of data that needs to be aligned and kept privately together. So these are all very specific to ART. And then there was an efficient, enhanced communication between physicians, anesthetists, and the lab personnel, as well as the nurses. So the main idea was to improve the treatment outcome, reduce the side effects, and also that outcome should be reflected. What is the outcome for us? It is live birth. So high pregnancy rate and healthy child is what we are looking at. Okay, this is how similar to what actually we are doing, minus the cable, which is behind. Okay, and then the COVID-19 happened, and I was happy to explore the applications of Microsoft HoloLens. And during the COVID pandemics, because we were promoting the touchless practice, so I saw the HoloLens. I mean, we checked it for using it with our PPEs that we were wearing, 2 gloves, 3 gloves, and then masks, 1, 2, 3, and we were testing it, whether if our commands are affected, our movement gestures are affected by wearing the extra protection gears. So now, we are in 2023. I must say that the AR and VR venture started at Tawam Hospital, Tawam Fertility Center. And then I worked during the pandemics, I worked at Faqih IVF Center. Currently I'm Director of Fertility Preservation at Bourne Hall. And here is where I'm exploring the metaverse for patients' consultations. So patient communication and procedure visualization of IVF process in metaverse. It gives you immersive feeling, it gives you in-person consultations. I've used the HoloLens using the applications that are already published there, or I just had to buy a few dollars that application to use it for private consultations. So it does have increased accessibility criteria to it. Is it efficient in time or convenient? No, that is still being tested. Lower cost. While I was trying to get a virtual clinic, I got a cost of anywhere from $5 to 95,000 dirhams. So I'm still exploring that. Okay, so the benefits so far of what we've perceived or have done is that the metaverse consultations, yes, it's confidential, shortens the consultation duration, it is effective, real-time interactions are there, easy flow of process. So from chatting, talking to the patients virtually, to video displays, to showing them the consents that they need to be reading and signing. Of course, lowers the guard, so they can talk about sensitive issues in IVF. And the whole process, the efforts that are going in metaverse consultations, it's awakening all the senses from all the sides, whether it is from the patient side or from the physicians. It's awakening all the senses. So it is entertaining, smart way of conveying your consultations. Patients would get more involved, interactive. We don't have counselors, and this would support them mentally for their mental health. Overcoming the challenge of reading in between the lines or small imprints. So, yes, so coming down to my conclusion is that AR, VR, and metaverse add new dimension to the practice of reproductive medicine and infertility treatment. It does lay the bridge towards the machine learning and AI practice. Needs more collaboration between computer scientists, physicians, and healthcare workers to make AR and VR. I feel personally it is still behind the schedule. Our multidisciplinary teams were including other physicians, especially when we see the onco-fertility treatment, we have oncologists and surgeons and physicians and hematologists. But I predict that we would have more people included in that multidisciplinary team approach, who will have health techs or health specialists or tech specialists be part of our MDT team. I would like to tell everyone that there needs to be stringent measures to protect the data security and address privacy concerns. 2 days ago, when we read a newspaper that 23andMe, the eSure, it's a DNA database or DNA testing company. A whole database was stolen and it is sold on dark web. That is my concern. I don't want my DNAs to be stolen, and I want to protect my patients as well. Now, we need to engage with our surroundings. We need to engage with our children, with our family. This is to keep up with the pace of rapid technological evolutions. It's happening very fast, and we need each other's support in getting through this thing. So, My last talk would be, or slide is about my startup, humble startup that I'm working on. It's called Kazim's Fertility Bazaar. For now, I would say that I'm working on a system that is enhancing the science and culture of reproductive well-being. It is me who has worked more than 25 years ago on our people, and it is me now who's working in UAE, and I've seen the platform and the progress, and it is me who would want to take the flame and carry the flame even forward into the future practice. This is a responsibility, but in a balanced way. So balancing innovative technologies with fertility treatment standards, legislations, and regulations. And watch out for me. Thank you very much for listening.
So much, Dr. Nahla, for your presentation on technology uses in reproductive health. Thank you.